Today we have presented the preliminary data of a combination of Pembrolizumab with lenalidomide dexamethasone in patients that have been previously exposed to both lenalidomide and proteasome inhibitors. I would have said that this was a heavily pretreated population. More than 3/4 of the patients had received 3 or more lines of therapy. 80% have received a prior autologous transplant. Virtually all, 98% of the patients were previously exposed to len and bortezomib, plus 1/4 of the patients were exposed to carfilzomib and pomalidomide. 76% of the patients were refractory to lenalidomide, and 50% of the patients were double, triple, or quadruple refractory. 80% refractory to the last line of therapy. This indicates that these were heavily pretreated and quite refractory population. This result that we have presented today indicate that the treatment was well tolerated, but I have emphasized that patients have all up until now have a limited exposure to the drug because the treatment is ongoing. The side effects that we have observed are no different from what you expect from lenalidomide or pembrolizumab. And regarding efficacy, we have data on the first 17 patients that were included in the trial, and the results indicate 76% of response, and this involve partial responses or better. And if you add the disease control, this go up to 85%. If you focus on the lenalidomide refractory patients, 5 out of 9, this means 55% of the patients achieve a partial response or better, and disease control was obtained in 75% of the patients. These results are really encouraging, but I should emphasize once again that are still very preliminary data, because this is an ongoing trial and we need more mature information in order to finally assess the efficacy of this otherwise really promising combination.